Sponsored by the Carpal RX. If you have carpal tunnel syndrome and have tried every non-surgical therapy to get rid of the pain and other symptoms, you might be considering surgery. Before you do, realize that you are your own best advocate, and only you can ask the hard questions that need answering. Here is a list of the most important questions you should ask your hand surgeon. Question 1. Why is this procedure being recommended? Are there alternatives? Question 2. What are the benefits of this procedure in terms of pain relief, functioning, and mobility? How long will the benefits last? Question 3. What are the risks involved? Question 4. What is the success rate of this procedure? Question 5. What is the procedure called, and how is it done? Question 6. Will the surgery solve the problem? Will I need any more surgery in the future? Question 7. How many of these procedures are annually performed at this hospital? Question 8. What percentage of patients improve following the procedure? Question 9. What will happen if I don't have the surgery now? Question 10. If I want a second opinion, whom can I consult? Question 11. Will I need any tests or medical evaluations prior to the surgery? Question 12. What kind of anesthesia will be used? Are there possible after effects or risks? Will I meet with the anesthesiologist in advance, and will they know my needs and allergies? Question 13. Will I have pain following the procedure? What pain relief or pain control measures will I be given? Question 14. How long will the recovery take? What are my limitations during recovery? Will I need assistance at home afterwards? For how long? What will the discharge instructions be? Question 15. Will I have any disability following surgery? Will I need physical therapy? Question 16. When can I return to work? When can I drive my car? When can I have sexual activity? Question 17. Are there any materials about this surgery that I can review? Be well informed about your surgery, and especially what carpal tunnel syndrome is. If you don't know much about it, here are some things you should recognize. Carpal tunnel syndrome is actually a disease that begins deep inside the wrist joint, inside a confined area known as the carpal tunnel. Inside the carpal tunnel, your flexor tendons, here shown in white, are very close to the median nerve, here shown in yellow. The tendons are surrounded by a fluid-filled sheath, here shown in blue. Under certain conditions, like rapid hand movement, that sheath begins to swell and it pushes against the median nerve. And that causes all of the symptoms of carpal tunnel syndrome. Discuss with your doctor the fact that most people are dissatisfied with their surgical results, while the overwhelming majority of people who use non-surgical therapy are very satisfied with their results. Your doctor should candidly and openly inform you of this, because those statistics are so important that the Association of Orthopedic Surgeons and the National Institutes of Health recommend that all patients try all non-surgical options before considering surgery. Those non-surgical therapy options are rest, night splinting, and deep tissue massage. These simple methods are very effective in relieving symptoms. In fact, deep tissue massage is nearly 100% effective, but only if it's used daily and for 2 to 4 weeks. Anything less is ineffective. But this isn't your everyday massage. It requires specific motions on the wrist and forearm that, over time, will drain excess fluid and break up adhesions over the flexor tendons. This will reduce inflammation, thereby reducing your carpal tunnel syndrome. So as you see, you don't need surgery, especially to treat carpal tunnel syndrome. Instead, professional deep tissue massage applied daily will be nearly 100% effective in alleviating your symptoms. To get this professional therapy for your carpal tunnel syndrome or wrist tendinitis, you don't have to visit a therapist every day. Instead, the Carpal RX will give you the same therapy at home. If you have carpal tunnel syndrome or wrist tendinitis, you owe it to yourself to try this remarkable product and take advantage of the 60-day free trial offer with every Carpal RX. If the Carpal RX doesn't relieve your symptoms, or if you just don't like it for any reason, return it for a full refund, including all of your shipping costs. The Carpal RX was specifically designed to treat the wrist and forearm. It works just like a therapist's fingers that are treating you for carpal tunnel syndrome or wrist tendinitis, except it treats you every day at a fraction of the cost of a therapist and in the comfort of your home. The Carpal RX automatically produces the same motions that a therapist uses to relieve pain and other symptoms. And it's so simple to use. Just plug it in, slide it on, and strap it in. Then relax. The Carpal RX will do the rest. The Carpal RX always has a 60-day free trial, so if you're not completely satisfied with your results, return it for a 100% refund, including all your shipping costs. The Carpal RX is guaranteed to permanently and easily get rid of carpal tunnel syndrome, as well as wrist tendinitis and repetitive strain injury. Visit the Carpal RX at carpalrx.com.